yeah, that has really, yeah, right.
Apologize to the people.
Yeah, sorry. But that's really changed. It's safer than ever to manage your own abortion outside of the medical industry because of medication abortion. And the medications used for that are pretty widely available on the internet, and they are very safe. So it is a viable option for a lot of people that are forced to look elsewhere for abortion care. And then there's also, of course, laws that target abortion providers ourselves and seek to criminalize the act of performing an abortion. And then besides just outright bans, there's also so many restrictions that have been put in place for abortion ever since Roe versus Wade went into effect, which limits funding that's available for abortion clinics. It makes it so that insurance companies aren't required to cover abortion, and it places kind of unnecessary statutes on clinics and how clinics can operate, and clinics are more regulated than any other healthcare provider. And in Minnesota specifically, other legislation that's happening right now, with something to keep in mind, is that Minnesota is surrounded by states that have already or are likely to ban or restrict abortion. Wisconsin right now is not performing any abortions. North Dakota wasn't for a while, but there was just a case that happened, and I don't know if they're going to start doing it again. So yeah, Minnesota is kind of an island of abortion access right now, and a lot of people are traveling to our state to access this. We have kind of seen an interesting effect. Minnesota was anticipated to see a 25% increase in the number of people traveling to Minnesota for abortion care. And I think the majority of those people seem to be going to the Twin Cities, and then the Twin Cities clinics are getting overwhelmed, and patients local to that area are traveling to our clinic. So we're seeing.
What do women do in Wisconsin? Excuse me, what do women do in Wisconsin that want an abortion?
They travel elsewhere. So in northern Wisconsin, they come to us, and we've always been the only abortion clinic in northern Minnesota and northern Wisconsin, so that hasn't changed. But I think the big change was in southern Wisconsin. Those patients are now mostly traveling to the Twin Cities, or like I said, medication abortion is also available online. The legality of that is, something that the women have to keep in mind, and the governor of Wisconsin and the attorney general of Wisconsin have said that they're not going to uphold the pre-Roe ban for abortion. However, there's nobody providing abortions in Wisconsin right now, so people just have to travel.
Some are also going to Illinois. The ones that are in southern Wisconsin are traveling downwards to Illinois.
So yeah, that's what's going on around Minnesota. However, in Minnesota itself, we are kind of going in the opposite direction. We are enacting a lot of protections for abortion access in Minnesota. A big one this summer was Doe versus Minnesota. It came just a few weeks after the Dobbs versus Jackson decision, and it removed restrictions to abortion in Minnesota. Some of those restrictions were that nurse practitioners and physician's assistants couldn't provide abortions previously, and now they can. There was a 24-hour waiting period, which meant that patients had to receive some state-mandated information, which contained medical inaccuracies, by the way, and then wait 24 hours before they could have their appointment. And that no longer happens. The parental notification law was repealed, so minors no longer have to notify both of their parents of their intent to have an abortion. So it just really helps remove some of the barriers that people faced in seeking this care, and it helped make our jobs a lot easier, because it was truly a lot of work and a lot of paperwork to make sure that we met these requirements. And Minnesota now has a pro-choice majority in the House, the Senate, and the governor's office. So yeah, and they are really putting that to work. The first bill on the docket this legislative session was the PRO Act, which enshrined the constitutional right to abortion in Minnesota. And we felt that that was very important to do, because as we learned with Roe versus Wade, a judicial decision doesn't always protect us. And so having that put in the legislature further protects abortion access here in Minnesota. And there's honestly a lot of legislation going on right now to protect abortion access. There's another case that's going through to increase the payments that we receive for providing abortions with medical assistance payments. So just support your legislators that are hopefully pro-abortion, pro-choice, because they're doing a lot of really important work right now. And then one other case that we're keeping our eye on, you may have heard about it, it's in the news a lot right now, is the Alliance for Hippocratic Medicine versus the FDA. That is a case that's in federal court in Texas that would, I don't know, there's like, apparently there's a lot of different ways the case could go, but the worst case scenario is that it could federally ban the use of one of the medications we use for medication abortion called mifepristone. And over half of abortions in the United States are medication abortions. That would have a huge effect on the entire country and the way that we provide medication abortions. And that decision could come out any day now, so we're keeping a close eye on that. And that kind of brings us to the clinic today. So in 2019, we changed our name from Women's Health Center to We Health Clinic to better reflect the services that we offer as well as the people that we serve. We Health Clinic has always served, well, besides women. You know, we do STI testing, birth control, wellness exams. We help people sign up for insurance, and we provide gender-affirming care, which we'll talk about a little bit more later. And a big change for the clinic recently was that our longtime executive director, Lori Casey, who has worked at the clinic for over 42 years and was our executive director since 2008, retired. And that's why we're here. I'm the new executive director and Jordan is the new operations director. And we were talking about it with Kathy earlier, but I don't think there are a lot of people left like Tim Welsh or like Lori Casey who were able to do it all. So it's taking two of us to fill her shoes, and we're really excited about it. So as the executive director, I oversee the overall fiscal management of the clinic, grant seeking, I do community relations and talks like this. And I also keep an eye on legal legislative happenings going on. And I work with our board to lead the clinic.
As the operations director, I take care of more of the day-to-day things at the clinic. I run the clinic for our abortion day, our GYN day that is deemed by our doctor that is on staff there, that is there at least once a week and sometimes twice a week on the days that she does abortions, Dr. Judith Johnson. I also work with all of the different abortion funds for our clinic that help women get their abortions paid for in different capacities. I also work with the building for women to do like the maintenance and different things that have to do with running the building with the other partners in the building. I also work with another staff member of ours, Cassidy. She is our lead person that does our escort program. So the people that you see standing outside of our clinic on abortion day with the rainbow vests that help our patients get into the building safely and block them from the protesters and report things and deal with the police and things like that. And I also do a lot with coordinating staffing and the doctor's schedules and things like that. And then a lot with our insurance and billing, since we do go through medical assistance to pay for abortion care. And just recently too, Minnesota Care actually does now cover abortion. So that's a huge thing for our clinic because there were a lot of patients that would have Minnesota Care that we would have to tell, you know, I'm really sorry they don't cover abortion. So, you know, you will have to pay, I think it was like over $500 that they would have to pay, even though they, you know, technically have medical assistance, but just in a different capacity. So it's really nice that we do have those things now. So that's kind of the things that I take care of. And me and Paulina have worked together for over about 7 years now. Both the clinic, we started about 2 months apart from each other. And when the conversation of Lori retiring started, I went to Paulina and I was like, we should do this. We should take over the clinic because, you know, we had been there the longest of any other staff member besides Lori, because other staff members had left. And we thought that it would be a lot better to take over as 2 people than as 1, because like Paulina said, nobody can do it like Tina and Lori. We really felt like 2 people really needed to be able to do it. Some of the services that we offer obviously is abortion care. We go up to 17 weeks and 0 days now. 17 weeks for suction abortion, 11 weeks for medication abortion, and then we also implemented back in 2021 doing telehealth medication abortion that really helped with the pandemic, being able to do that with patients. They do need to have a Minnesota mailing address or be in Minnesota. And they have to be in Minnesota when the service does take place. So it is a barrier, but at the same time, it has helped out a lot of patients, and we have had a much higher increase of telehealth medication abortion patients, just because it's a lot easier being able to have the medication. Oh, sorry, go ahead.
Explain that again. Oh, sorry. Just that, when you started with this last.
The telehealth.
Yes.
So the telehealth medication abortion that we do, so what we do is we do a almost kind of like a Zoom appointment with the patient, with the doctor, and they get information about the medication ahead of time. They fill out forms online, they submit them to us. Our nurse is in contact with them and kind of walks them through the steps of having their abortion. We have one of our patient educators call our patient on the day of their appointment and go through everything they need to know about their appointment and the medication they're going to take, the side effects, how to do it, everything like that. They talk to the doctor goes through the information that they need to give them, and then we mail out their medication in a nice little box, and it arrives to their house in about 3 to 4 days. Weather sometimes, causes problems with that. But otherwise, then they are able to do it all at home, and they never have to leave their home. Another thing that they are able to do as well is they can do a telehealth appointment, so do all of the things over the phone and through Zoom, and then come to the clinic and just pick up their medication. So it's a lot quicker of a process for a lot of patients. People that have lots of things in life going on. It's just a lot better of an appointment time for them.
Good. Thank you.
So yeah, we offer obviously abortion services, and we can continue to be, like Pauline said, only abortion provider in northern Minnesota, serving northern Minnesota, northern Wisconsin, and northern Michigan. We have had patients come from all over. It just kind of all depends on where they can get in best. We have we don't even have a week wait. We can pretty much get you in. I mean, if we have abortions on a Thursday, you call on a Wednesday, we are usually able to get you in usually the next day, if not within a week. It just kind of depends on the busyness of our schedule.
And that's compared to currently clinics in the Twin Cities, they often have weeks of 2, 3, 4 weeks. And with abortion being such a timely medical procedure, it really makes a big difference for people to be able to access our care. And that's why a lot of, like I said earlier, patients are traveling from the Twin Cities to us, because we just have shorter wait times.
Yep. So we have a local doctor also that provides a lot of GYN care. So we do wellness exams and pap smears. We do LGBTQ plus health services, gender affirming hormone therapy care, STI and STI testing and STI treatment, including rapid HIV and rapid syphilis testing, vaginitis, UTI testing and treatment, PrEP, which Paulina has worked with more than I have. Contraceptives, including IUDs and implants, emergency contraceptive, ultrasounds, pregnancy testing, and options education. Options education, if anybody doesn't know what that is, it's more so if someone calls and they're pregnant and they want to come in and talk about their 3 different options, or if they just want to talk about their options with abortion care. It just kind of depends on what they want, and we kind of just let them take the lead of what they'd like to do for their health care. We do miscarriage management, follow-up supporting patients who have had abortions at other clinics. So we've worked with Just the Pill a couple times. They're a big telehealth medication abortion business. That's pretty much their entire business, is doing telehealth medication abortions. They popped up, I want to say in 2001 or 2021. And they pretty much are able to get you in within a day for an appointment. So we've also been working with them to let them know that we can do follow-ups for any of their patients that say, misjudged their dating of their pregnancy dating. So if they were further along than they thought they were and the medication abortion didn't work for them, they're able to call our clinic and we are able to, get them in to get them help. Yeah.
Yeah, I just wanted to add, telehealth medication abortion is amazing, and it's great that it's so widely available now, and that people are able to access these medications online. But something to keep in mind is that it's also just really important to continue to support brick and mortar abortion clinics, because there's always gonna be people that are too far along for a medication abortion. And even though abortion is extremely safe and complications are rare and side effects are rare, it's important to have experts who can deal with those complications after the fact as well. So we're happy to help people who have had a telehealth medication abortion elsewhere or a regular abortion elsewhere, and we're available for follow-up care for them.
We also do insured navigating, so we help people get signed up with insurance, and then also just telehealth services. We pretty much implemented, sorry, words, telehealth services with the pandemic. So we were able to do birth control consults over telehealth. A lot of our hormone therapy patients are able to do their appointments over telehealth. Yep, go ahead. Do you have a question?
Question, comment?
Oh, okay.
No, Tom Betts is just moving his head apparently. Just wanna settle down.
Some of our numbers for patients for 2022, we had about 568 abortions, 249 were suction, 190 were medication, and then 129 were telehealth medication abortion. So we definitely upped our numbers with telehealth medication abortion, because in 2021 we only had 28, so we over, probably quadrupled.
Just a minute, we'll bring in the microphone. Maybe ask, of course, they can't talk, but you could ask them if they can hear with these questions.
Okay.
With the medication abortions, is there a time when you would recommend that a person come into the clinic for that as opposed to doing it at home? The other question I have is, isn't that a two-step process when you have to get a second medication later, or are they now, taking, I'm thinking back of somebody I know who had that, or do you have them both in one day and it's just one?
So it's a 2-day process. And so with the first question, we recommend anybody that doesn't have, for our clinic, you have to have a Minnesota mailing address or be or a Minnesota resident. So if you're in Wisconsin and you don't have, a Minnesota mailing address or any way of getting to Minnesota to do your telehealth, you do have to come into our clinic to have it done then, or anybody from the outside area kind of a thing. Otherwise, and then with the medication abortion, it's a 2-step. So first is the mifepristone, which is the first dose of medication that you would take. And then the second dose of medication is misoprostol, and it is about a 2-day process. Yes. So you take your first dose of medication, which is mifepristone, 1 day, and then 24 to 48 hours later, you would take the misoprostol. And anybody over 9 weeks gets 2 doses of misoprostol. And all of our telehealth medication abortion patients get 2 doses of misoprostol just in case if they were to need it. Yep.
And yeah, from a medical standpoint, telehealth medication abortion, it's been done kind of all over the world. So there is a lot of data to show that people are pretty good about knowing how far along they are in their pregnancy, just based off of last menstrual period or date of conception. But we do want people to have an idea of how far along they are for telehealth medication abortion, since there isn't an ultrasound being done ahead of time. So if people aren't sure how far along they are, that we would have them come to the clinic. Or there's also certain aspects of health history that might disqualify them from telehealth medication abortion. The big one that we're watching out for is ectopic pregnancy. About 1% of pregnancies are ectopic. And so if someone has a history of ectopic pregnancy or other things in their health history that could increase their chances of having another one, we would disqualify them from having a telehealth medication abortion and tell them to come to the clinic instead.
Yes, we go through a screening process with each patient that says that they want a telehealth medication abortion to make sure that they pre-qualify, and then they submit forms, which one of them is their health history form, and then our nurse reviews that and tells them that they do completely qualify for the telehealth medication abortion. Some other numbers for services is for family planning patients, we've seen 446 in 2022. Gender affirming patients, we've seen 20. STI testing, we had 593. Enrolling people in insurance, we had 7, and then some assists, we had about 74. Emergency contraceptive units dispensed, we had 105. For IUDs and Nexplanons, we had about 69. And for unduplicated patients, so that would be patients that we had not necessarily seen before, we had 1,156 patients in 2022. So a big thing that we deal with, obviously being in an abortion clinic, is the anti-activity or activists. So a lot of them have been really persistent, obviously since Roe v. Wade fell. They have been a lot more aggressive and a lot more persistent in their efforts to stop us from providing abortion care. So we have groups outside of our clinic, about 3 to 15, depending upon the day. Almost every Thursday, Friday, they are there. We have volunteer escorts that help our patients get into the clinic. They're always the people that are wearing the rainbow vests outside of our clinic. On days that we think that we're going to have a large presence of them, we will sometimes coordinate with the lead escort, which is Cassidy, who works at our clinic. She will then kind of coordinate with anybody that is in the area that can come and support our clinic, even on days that we're not doing abortions. Some of the tactics that they have been doing lately is calling the police more often. We had a week where they called, I think 3 out of the 5, or we had for 3 weeks in a row, they called every single week for different things that were not important, I guess, in a way of us looking at it. One of our anti-abortion people, they called the police because they were standing outside of our fence, and one of our escorts was standing inside of our fence, and they said that they felt intimidated, so they called the police. And yeah, and it was just kind of like, what are you doing to the patients every day? So that was one of the things that they called the police for. And so they have been calling the police, and our protocol for that is all of our escorts go into the building and they don't answer any questions by the police or anything like that. And only we have clinic staff deal with them, just because our volunteers are not, that's not what they signed up for to do, was to deal with the police. So other things that the anti-abortion groups have been doing is putting their bodies in between our escorts and our patients. They've been trying to get into patients' cars. They have been making calls to the clinic asking about after birth abortions, which is not a real thing. They have been following patients over, a block down the street on foot. They've been lying to patients about what they can and can't do inside of our clinic. One of the examples is telling them that they cannot view their pregnancy tissue, or that we will not show them their ultrasound, which is an absolute lie, or that they can't leave our clinic whenever they want. If any patient decides any part of their appointment is, they're like, nope, I don't want to have an abortion anymore, we're like, okay, that's fine. And we, we just, tell them that they can leave, and, if they were to change their mind, or if they need any other services for us, we tell them to give us a call. But no, it's all in their hands. They're never told that they had to stay at our clinic or anything like that. Some of the crisis pregnancy centers, there are about 93 CPCs in Minnesota, compared to about 9 abortion clinics. So one of the things that they will, and we actually have one across the street from us that is called the Women's Care Center. They originally tried to mimic our name of the Women's Health Center to the Women's Care Center, so to confuse patients, which they have actually done quite a good job, because they confused a lot of patients that end up going there and not to us. We actually had a problem last year where if you looked up our clinic, their clinic popped up. So we had to put something on our website where it was a picture of their clinic and a picture of ours, saying, their clinic is the wrong place, please don't go there, and a picture of our clinic so that they could see where they needed to be. Another thing that they do is they will give patients false information about their ultrasound, telling them that they are, say, farther along than they are, or not as far along as they, or less far along than they actually are. So they can tell someone that they are 10 weeks and they have lots of time, when they actually are 13 weeks and can only be seen with us for about another 4 weeks. And then they call us and they come in and they're too far for our clinic, and then they have to go down to the cities, which, just causes a barrier to that patient. They do not tell patients all about their pregnancy options. One of the most recent things that they have been telling patients is that patients have to have an appointment with them before they can have an appointment with us. Which is completely false. We don't want any patient to go there. They are not a medical facility. They do not have any medical staff that helps with, doing ultrasounds or anything like that. We have medical staff, we have a doctor that reviews all of our ultrasounds and things like that. So that's kind of some of the things that we have been dealing with the crisis pregnancy centers. Some of the funding sources and financial challenges that we have is that our nonprofit funding sources would be patient fees, private insurance, Minnesota medical assistance, Minnesota Care, abortion loan funds, Medicare navigating payments, grants and or foundations, and donations. So that's kind of all the different ways that we are able to make.
So I hate to say this, but we only have 5 more minutes. I know, people to actually like go to the church service. I don't know. Because, we think the forums are spectacular. But
Well, I'll quickly just go through our financial challenges that we have. So one of them is Minnesota Care and Minnesota Medical Assistance do not cover the complete cost of an abortion. So we only ask for a small copay from our patients, but what we actually are reimbursed is a fraction of what it actually takes for us to actually provide the abortion to patients. The other thing is that, especially with telehealth medication abortion, they just do not, they barely cover enough for the medication, which, I think telehealth medication abortion will also to maybe be one of the things that we do the most amount of work for, especially our nurse. She does take a lot of time and energy to do everything with printing out forms and contacting patients and staying in contact with them and things like that. Because the cost for a telehealth medication abortion is about $400, and we are reimbursed less than $60 from the state for that procedure. And so far this year, we've had 40% of our patients have used medical assistance. So that's a pretty big number of patients that we are not reimbursed for from the state. Mostly it's medical assistance that we don't get too much reimbursement from. But we are really lucky that we do have a lot of loan funds that patients are able to get. So a lot of women are able to have their entire abortion paid for, usually from the loan funds, and things like that. So do you want to add?
So ways to support the clinic are obviously donating. Thank you again so much for choosing us to be the recipient of your Woman Basket offering. That's amazing. And we also have fundraisers throughout the year that you can join us at. You can always volunteer as well, either as being an escort outside of the clinic. That is pretty intense for a lot of people, so no pressure to do that if you're not comfortable with that, because it does get kind of heated out there. We also do have a separate volunteer group that does more low-key things, helping out around the clinic with different projects, as well as at our fundraisers. You can find information about all of that online. And then, of course, voting and contacting your legislatures about issues related to reproductive health care. And I think that's about it. So if anyone has any last minute questions.
Did Walgreens banning carrying the med in some states that didn't affect us here, did it?
No, well, it didn't affect our clinic at least because we dispense all of our medications for our clinic ourselves. So yeah, it didn't affect us. I haven't heard a lot about providers prescribing medication abortions and then having someone go to a pharmacy to pick it up. Honestly, the model that most people use is that the doctor's office itself dispenses the medication, so I don't think it really affected them much. Yeah.
And then with the increase of people coming, do you have enough staff? We keep hearing on television, oh, there's low staff everywhere. Are you getting enough staff?
We are pretty good on staff. We have not had a almost every single person that works at our clinic works there because they want to. It's not for the paycheck or anything like that. It's because they have a passion for the reproductive health care that we do and things like that. So yeah, we're pretty good on staff. However, if you are, if you know any doctors in the area that want to perform abortions or actually an accountant as well, our accountant is looking to retire and we are looking for an accountant. So any accountants or any doctors in the area that want to perform abortions or want to work for our nonprofit, that would be fabulous.
The accountants will not be doing the abortions. Thank you, Will. Yeah, thanks for that. We have another, yeah, we can try a few more minutes. I mean, if there's people at home, they gotta hop in their car and come here.
About the funding, if you receive so much less from the state and then maybe the patient pays a little bit, is that where the funds come in that you raise through private groups to cover that cost? Because you said something about receiving a grant, but if they're on, they still need a grant if they're on Medicare or Medicare, or does that for people who like come from out of state or have no insurance?
That's more, so the patient pays, who have medical assistance or Minnesota Care, they pay a small copay and we just kind of take the loss. And we rely on grants and donations to make up the difference on that loss. And again, nearly half of our patients, we are operating at a net loss on. And the abortion assistance funds are more for patients that don't have insurance or who are coming from out of state to help pay for their abortions.
One of them is our local fund. It's called Potish Militia, and they actually have helped out with funding a lot of different things with patients, even patients that have medical assistance, because we do offer nitrous oxide to some patients now that are having suction abortions, and Potish has offered to cover a lot of that cost for patients even that have medical assistance, because it is an extra payment that they do have to make. The insurance does not cover that. And they also have offered to help pay with, like, ultrasounds for some patients that are coming into the clinic and things like that. And some of our other local funds, they do also cover some birth control options for patients. So if you're out of state and they want to get a birth control, and of course, lots of birth controls are very expensive. We have different funds that actually give us grants for birth control.
Is there anything in the chat? You guys can see the chat. Any?
There's nothing right now. Does anyone online want any questions answered?
Put it in the chat. They can unmute themselves. Well, we really want to thank you guys for coming today. And we got one more. Geeker's got one more there. One more thought or question.
This afternoon at 4 p.m. there will be a film at the cinema. It's sponsored by Planned Parenthood of our community, the North Central. I think it is the local Planned Parenthood. Its battleground is an urgently timely window into the intersection of abortion and politics in America, following 3 women who lead formidable anti-abortion organizations to witness the influence they wield. As the nation faces the end of Roe, the film also depicts those on the front lines of the fierce fight to maintain access. And I mention this because the work that's being done in film is pretty powerful, not just on this topic, but all topics of citizenship.
Yeah, I will be doing a Q&A with our doctor, as well as the leader of our escort program after the film. So yeah, hope to see you there.
It says cinema. I don't think it's online. Go online and register and buy a ticket. You actually have to go if you want to see the film. So the other thing that I'm going to say quickly is there's also currently a GoFundMe campaign to raise money for the Building for Women, which is has a significant shortage of funds in order to do what they need to do. So if you want to support the Building for Women, you can. Sure, if you Google GoFundMe Building for Women, or we could see about sending out that link to folks.
It's also on our website. You can just go to our website, or sorry, on our Facebook.
Go to the We Clinic Facebook place. So with that, again, I want to thank both. Big round of applause for the speakers today. We did a great job. Also, remember they are the Woven Basket recipients. So when the basket comes around for every Sunday in April, feel free to give generously.